Okay, we're gonna palpate the muscles of the hip. So I'm going to start in the supine position. Just remember that when you're palpating someone, you should be on the same side as your patient. I'm on the other side just for the sake of the video so that you can see it. So in the supine position, I'm going to palpate the iliopsoas, the rectus femoris, and the sartorius. I want to do these three together because it kind of helps to find them. So the best way to start by finding this is to find the ASIS. Sometimes this is difficult to find or it's a sensitive area to your patient. So a tip that you could do is always ask the patient themselves to find it, and then you can get your fingers over it. So we know from our anatomy that if we drop just inferior to the ASIS, that's where the rectus femoris is going to be. It's a superficial muscle located on the anterior aspect of the thigh. It does hip flexion and knee extension. So if I take my fingers and I drop just a little inferior, I can ask my patient to go ahead and do a straight leg raise. So go ahead and lift up, and I can feel that popping up into my finger. Go ahead and relax. We did palpate this at the knee as well, but I'm using it here because it helps to find the other muscles. The next muscle we're going to palpate is the sartorius. So if you remember from the anatomy, the sartorius starts at the ASIS, but it immediately runs medial to the rectus femoris. It comes down the thigh, and it'll attach at that pes anserine. So what I'm going to do again is I'm going to find the ASIS, drop inferior because I know that's where the rectus femoris is, and from my anatomy, I know that if I move a little bit more medial to that, I should be on the sartorius. The sartorius does hip flexion, abduction, lateral rotation, and knee flexion. So this is like your hacky sack or your soccer dribbling move. So if I ask my patient to go ahead and do that motion, I will feel that muscle pop up really well into my finger. I can run down the medial aspect and find that muscle as well, but it pops up really good right there if they do that action. Come back down. So now the last muscle is the iliopsoas. This is a very deep muscle. You're not going to be able to confirm that you're on it where you're going to palpate because all of these muscles are going to contract. They're all hip flexors. But what I know is my ASIS, I drop low to my rectus, then I come over to my sartorius. If I come over a little bit more, so you're kind of coming into the crease of like your hip. So if I get to that point and I push down a little bit deeper, that's the best way to get to the iliopsoas at the hip. So again, I'm going to ask my patient to do a straight leg raise, and I should feel some contraction in there. I can still feel the sartorius, but if I go a little bit more medial, that's how I know I'm going to be on the iliopsoas. Okay, now I'm going to ask my patient to go into the prone position. We're going to palpate the glute max and the piriformis. The glute max is a superficial muscle located on the posterior aspect of the pelvis. It does hip extension and lateral rotation. So I'm going to ask my patient to go ahead, and they could either do one of two things. They can lift their leg straight up. We'll just lift this leg straight up in the air, and then I'm going to be right on the glute max, or go ahead and relax. An isometric contraction can be to ask them to kind of squeeze their glutes together. So they squeeze their butt together, and that's how I get that muscle to contract. The other muscle in this area that's an important muscle for you to know is the piriformis. So the piriformis does lateral rotation. It is a deep muscle, so we are not going to be able to palpate it and know that we're on it, but we will do soft tissue, ultrasound, and if a patient has sensitivity there, when we palpate it, they're going to let you know that you're on it. So we want to make sure we can visualize where it is. So if you remember that the piriformis, it's a deep muscle located on the posterior aspect of the pelvis, and it runs from the sacrum out to the greater trochanter. So if I find the sacrum and I find that greater trochanter, I'll come on this side. If I find the greater trochanter and the sacrum and I run my fingers straight across, that's how the piriformis runs. So if I go about halfway and I push and I say it's going to be in here and it's going to be deep, that's how I would palpate the piriformis. The last group of muscles we'll do is going to be in the sideline position. So I'm going to ask my patient to lie on your right side. And we'll do the gracilis first. So the gracilis is the superficial muscle located on the medial aspect of the thigh that does hip adduction. So I'm going to actually palpate this on her lower leg. So I'm going to ask you to straighten your lower leg and then bend this one up. So this is kind of the best way to get at it. Now the adductors are in here, but we're just going to go for the gracilis because it's that superficial muscle and it's as medial as it can be. So I'm going to go right here and I'm going to ask my patient to go ahead and lift up. That's going to be hip adduction, and there's the gracilis. I can feel it pop right into my fingers. Okay, Go ahead and bring this leg back. You can keep this one bent, and we're going to palpate the other two muscles here. The last two muscles that we're going to palpate for the hip are the gluteus medius and the tensor fasciae latae. So let's do the glute med first. The glute med is actually going to be superficial and the most lateral aspect. It does run deep to the glute max, you could describe it that way, but if you go from the iliac crest, can you bring your leg back just a little bit for me? Good. The iliac crest down to the greater trochanter, then you know if you draw a line from origin insertion that you should be right on the glute med. So it's a superficial muscle located on the lateral aspect of the pelvis or the hip. It does hip abduction. So go ahead and lift your leg up and then come back down, and it's going to be right in this area here. So one finger, I would go right there. The tensor fasciae latae, or the TFL, is the muscle located on the anterior lateral portion of the hip. So if you remember, this is the muscle that does hip flexion and abduction. It's also the muscle that's kind of small, and it becomes that IT band that runs all the way down. So we palpate the IT band out here, but to find the muscle, I want to stay up in this area. So it originates at the ASIS, so I'm going to find that ASIS again, and I'm going to come inferior and lateral to it. So I'm going to see the superficial muscle is going to be right about here. So I'm going to ask my patient to flex and abduct. So she's going to come forward and up, and I could feel that muscle coming right into my finger. Come back down. So remember, the difference is the glute med is going to be pure abduction, and the TFL is going to be flexion and abduction. So you want to make sure that you decipher those two.